Hey guys, this is Dr. Mahajan from Mahajan Medical Center. Very excited to bring our live webcast back after a couple of weeks of break. We have a wonderful guest today. He's a physical therapist, he's a doctor of physical therapist, Jacob, and we're going to get him on our webcast in a minute. Hello, Jacob. Thank you for coming to our studios to join me for another wonderful edition for our patients to learn from all the thought leaders. And you are a thought leader with physical therapy. So welcome.
Thank you so much. I appreciate it. I really appreciate the opportunity to come and talk to you, talk to your audience. I always love our conversations. So it'll be nice to have another one and to be able to share it with a few people. So we are a physical therapist owned practice. So all of the clinics in the area, and it's almost entirely in the Tampa Bay area. There is one in South Florida, but largely we're in the Tampa Bay area and sort of surrounding areas as things expand a little bit. But each one is owned and operated by physical therapists. So what we do and how we do it is guided by those of us who are actually, on the floor treating patients and understanding what it takes to treat and help people. But also to run a business, run a clinic.
What are the top 10 things people normally come to your clinic for therapy for?
It's a pretty wide variety. I mean, there are some common issues, spinal issues. Really, that's the bulk of most people's problems, whether it's neck or lower back or mid and upper back. That really, has a high percentage. But a lot of shoulder issues and knee issues and hip issues and ankle issues. So, if you think of all the major joints in the body, elbows and wrists, we see a fair share of everything. First things first, PT is physical therapist, not pain and torture. Our goal is to help people move better. It's not to inflict or cause pain. Pain is a byproduct of some of the treatments that we go through. That is certainly true. But what you want to understand as an individual potentially coming into physical therapy is that you want to have a better understanding of when that pain is what we would call a productive pain, when it's something that actually is helping you achieve a goal, or whether it's something that's actually hurting and making a situation worse.
Right. So the third myth we're going to tackle is that physical therapy is just about I, seat, and tense. Is there more to it, Jacob?
There's more to it. These are things that I hear on a regular basis where someone says, oh, I've had physical therapy in the past. We did heat, we did ice, we did some electrical stimulation. And not that any of those things are wrong or inappropriate. They can be used properly in a number of different conditions, but there's a lot more to it. I would say the number one thing that we do in the clinic is actually education, helping you understand what it is that you're doing, what you're not doing, what you could be doing better, how you are moving, and where the problem really comes from. And when people understand that, guess what? They can fix themselves. That's the goal. So we try our best to educate on what's happening and why it's happening and how we might make it better.
Any final words of wisdom from physical therapy world, Jacob?
Keep moving. All right, keep moving. I hate to sound sort of boring, but if you don't move it, you lose it. It couldn't be truer. So continue to move. Try not to be afraid of movement. If movement hurts, let's come talk to somebody who knows what they're doing, because we want to get you moving as fast as possible. So do as much as you can, and then we'll help you with the rest.
At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting.